And thank you for viewing this virtual post and presentation hosted by the American Institute Dental Public Health Summer Colloquium. My name is DIEP and I'm the Health Science Specialist from the DentaQuest Partnership. My topic for today is Understanding Value in Oral Health and the Oral Health Value-Based Care Summit. The DentaQuest Partnership for Oral Health Advancement put together a national oral health value-based care summit for 46 participants over the course of 1.5 days in December 2019. The participant group comprised of leaders with various health backgrounds, and I'll go into it later in the next slide. The purpose of the event was to have an in-depth discussion on the current state of oral health care and delivery and payment, the desired state, the change agents that will move us from where we are now to where we want to be today. On day one, participants were provided background information on value-based transformations to healthcare and how those trends might apply to oral health environment. The second day was organized according to a gap analysis process. So we had 3 different panels discussions followed by small group discussions related to each of the 3 gap analysis area, which is current state, desired state, and action planning and closing the gap. Participants were also asked a series of questions on the first day to gain a better understanding dynamic. So these questions related to their main area of expertise, the depth of experience, and their employment type. So as you can see here, there was an average of 23 years of experience. This group published an average of 8 papers per participants within the past 10 years and accumulatively cited approximately 4,000 times within other publications. They have an average H-index score of 4.8. There were several key themes that emerged from each of the 3 sections, and they were all important to moving value-based care and payment in the oral health forward. So the first panel was on the current state of oral health value-based care. So there are 3 themes that were listed there. On the second panel was focused on the future and desired state of oral health value-based care. And there's another 3 themes that was emerged from there. And then this last panel was on closing the gap and with action planning. There was 2 themes that were emerged from there. So findings from the value-based oral health care convening showed that 79% of the participants indicated that there hasn't been much progress within the past 10 years when it comes to value-based transformation, and that when it comes to value-based transformation, the best solution to shift towards this transformation is through benefits and payment structure. And in addition to that, most attendees also noticed that value-based care reimbursement is necessary to have a successful healthcare system. And there are several barriers to this, and I'll address this on the next slide. The summit also concluded that 75% of the participants strongly agrees that improved medical and dental integration is vital for a successful value-based care model. So participants were asked word cloud questions throughout the summer, and one question was around barriers to growth of value-based care and reimbursement in oral health. The word cloud here shows that standardizations, diagnostic code usage, and the need to provide trusted value through measurement are necessary for success. And so that we must continue to work towards these barriers if we want to enhance the delivery of oral health care. The qualitative data also captured from the table discussions were compiled and analyzed to find common themes, and that was discussed earlier on the presentations and prominent areas of discussion. So each major theme point were assigned within a gap analysis as current state or future state or ideal state and the action state. So you can see the common themes here. So based on the information gathered from the convening, the oral health community is driven to shift towards this value-based care oral health delivery system. However, there is still a lack of uniformity on how to execute this delivery model. So further research is required to better understand the value in oral health. So with that, if you have any questions regarding this study, please reach out to me or my other colleagues from the DentaQuest Partnership. I'd be happy to reach out to you via email. Thank you.